this meeting to order and start by acknowledging that we're meeting on the traditional unceded territory of the Algonquin people. The committee is meeting to continue its study of support for Indigenous communities through a second wave of COVID-19. To ensure an orderly meeting, I would like to outline best practices to follow. Participants may speak and listen in the official language of their choice. At the bottom of your screen, you'll see a globe, and you should have...
Chair?
I'm sorry?
Your sound is awful. I can't hear you.
Well, I'm not sure how to fix that. How is this anti-disestablishmentarianism? Volume, volume, volume. Is that better?
No.
Well, okay. I've only done this for 45 years as a professional broadcaster, so I'll try again.
Is your microphone on?
We're meeting on the traditional unceded territory of the Algonquin people. The committee meets to study support for Indigenous communities through a second wave of COVID-19. Participants, once again, at the bottom of your screen, there is the globe
Chair, we
icon,
have nothing on you
bottom
at all.
center.
Can't hear you at
And
all.
you should select either French or English, depending on the language you wish to speak in and hear the interpretation in. And when speaking, please speak slowly and clearly. When you're not speaking, your microphone should be on mute. Now, with us today by video conference for the first hour are the following witnesses. We have Christine Agro, the legal counselor of International Union of Operating Engineers, Local 793. We have Dwayne Smith, the chair and CEO of Inuvialuit
We cannot hear
Regional
the chair. It's
Corporation.
echoey and very hard to understand.
All of us back to our offices. You could just put our services right in front of us. Wi-Fi.
Might be your mic. We'll just pause for a second.
I don't
That's
think
okay.
Resolved. And I hope you heard my instructions with regard to translation. It's really important. No, we don't have it?
You've gone again.
Clerk, the chair
I have my Surface Pro here.
seems to have another device on, possibly, it looks like, in addition to the floor audio. Maybe there's some feedback from that.
Okay, we'll look into it. Hang on. There's no other device that could be on there.
No. What they're going to do, they're going to do a quick test. You're going to just disconnect the post here and see if it solves the problem.
Okay.
Do we have translation yet? The meeting has been called to order. We've had technical difficulties. I've given my instructions to the witnesses. They are standing by, so we're going to go for 6 minutes of presentation by each witness, followed by questioning. And if we could start with the legal counsel for International Union of Operating Engineers, Kristen Agrell. Could you please go ahead for 6 minutes?
Good morning. Thank you. My name is Kirsten Agrell. I'm with the International Union of Operating Engineers, Local 793. I'm speaking to you from our office in Oakville, Ontario, which is in the traditional territory of several nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, and the Haudenosaunee and the Wendat peoples. So the International Union of Operating Engineers, we have our roots in construction, but we also represent lots of workers in mining and in industry. We have about 17,000 members, and we operate throughout Ontario and in the territory of Nunavut. More recently, we represent about 1,000 people in a mining bargaining unit in north of the Arctic Circle on Baffin Island. And about 15% of our members at that bargaining unit are Inuit land claims beneficiaries living in communities in the north. We've also been growing our representation of Indigenous workers in Ontario who continue to be underrepresented in the skilled trades, in our view. We also have an Operating Engineers Training Institute, which is our training arm, which works with Indigenous training and employment organizations to try and remove barriers to entry into skilled trades, and our trade in particular. So as a representative for all our members, we've definitely seen through the pandemic the different impact that it's had on our Indigenous members than it has on our other workers who are also struggling, but it's been a different experience, I think, for those of our members. So we have 3 areas we really want to sort of quickly would be our recommendations to try and help Indigenous communities, all coming through our lens. Obviously, our focus is always on construction and heavy equipment. So the first thing we wanted to recommend was a real commitment to improve essential infrastructure, including broadband connectivity, water services, all these things that will help reduce the disproportionate risk that is being faced by our Indigenous members compared to other people in non-Indigenous communities. Second thing is assistance by the government to remove the barriers to training, and particularly having to travel to COVID-19 hotspots, to urban areas, to the cities, to get training and to participate in the workforce. And third, on the health and safety side, to prioritize availability of rapid testing, particularly for people in Indigenous communities, so that if people are continuing to work through the lockdown and the pandemic, as many of our members have, that they're not doing so and exposing their vulnerable communities to increased risk. So on the infrastructure side, I know this committee has already heard about it. It knows about the impact on communities without sort of the underlying healthcare infrastructure or sanitation infrastructure, and with overcrowded housing. And I know you've also heard about the impact on economic side, on the small businesses and tourism that are having so much trouble. So our view is that improvements to infrastructure is critical, not just for health reasons, but also to participate in sort of the economic recovery once this thing is through. So we're suggesting an immediate commitment to telecommunications construction projects with timeframes set. It should be a real priority. We know our members who are right now trying to work from home or trying to help their children go to school from home and are having real trouble because of internet connectivity issues. We as an organization have been trying to ramp up our efforts to reach out to people online, and the lack of connectivity has been a problem. Facilitating infrastructure, telecommunications infrastructure construction also provides training and opportunities for work close to their communities for people to not have to travel for Toronto. So we really support the Universal Broadband Fund that we've heard about. We do want to say you need to make sure that enough of that is allocated for Indigenous communities to make sure that it's really good lasting quality infrastructure that goes in there. Of course, like everyone else, we're also very concerned about the boil water advisories and the sanitation. Anytime people are having to leave their communities, even in Southern Ontario, to get clean drinking water and go into sort of COVID-19 red zones to do that, that's a problem. So we definitely want to say don't leave that behind or deprioritize it because of COVID. We know about the Indigenous Community Support Fund, which was announced. We understand that is more for services that provide education and training, which is great. We would like to see some sort of dedicated funding for COVID infrastructure work. We know in Ontario, they've announced something called the COVID-19 Resilience Infrastructure Fund, which I know has some federal funds too. We don't know how much, if any of that, is earmarked for Indigenous communities. We certainly suggest it should be. This, as I understand it, is funding to go specifically towards retrofitting schools, recreation centers, ventilation, and to enable sort of social distancing. So if there's not such a fund specific for Indigenous people, we think that's a good initiative and something we'd certainly encourage and recommend. I was going to time this. I don't know how I am on my timing. The other areas we want to recommend. Training. We work with, or the OITI works with the Aboriginal Apprenticeship Board of Ontario, which has identified barriers to training, and having to travel into urban areas is certainly one of them. Enabling bringing training into Indigenous communities is expensive and hard. It's a big territory, it's a big world, so government assistance with that. And then finally, we've got members, most of our workers have continued to work and be in essential services throughout lockdown, but for members coming from very vulnerable communities, having to choose between continuing to work and potentially putting your community at risk has been very different for Indigenous workers than from some of our other members, particularly in the far north and Baffin Island. So rapid testing and the availability of that for Indigenous communities is something we would think the government should prioritize to help sort of put that final health and safety piece in to enable people to keep working who are able to and want to keep working during the pandemic.
And that's just about it. Thank you very much, Mr. Grau. Next is the Chair and CEO of Inuvialuit Regional Corporation, Dwayne Smith. 6 minutes, Mr. Smith. Please go ahead.
Yes, thank you. Hopefully you can hear me okay. Thank you for the opportunity again. I just want to point out, as you've said, my name is Dwayne Smith. That's my English name anyways. I'm located just near the northeast tip of Alaska. To give you some perspective, it's roughly 9 hours by jet to get here from Ottawa, but I'm still in the same country. The area I represent is almost 1 million square kilometers, 2/3 of that being the ocean in this area. Just to give you a perspective in regards to the size and the scale of the geography I represent and the distance that I'm speaking to you from. But again, like I said, still a part of Canada. There was discussion earlier as we were getting set up. I am so far north that in a couple of days we'll be losing the sun for about 5 weeks. That's just part of the process here. I do want to give you an update in regards to the COVID activities that we have been implementing. We've been working hard with different federal departments to access funds that are identified for Indigenous organizations such as ourselves. What we have been able to do is allocate funding for food baskets, is what we call them, to needy households and families. We've also provided support in regards to harvesting and food preservation supplies to try and enhance and or address the food insecurity in the region. We've provided sewing supplies to communities for them to distribute. That's part of our cultural approach to our activities. We provided household cleaning kits so that people can further sanitize and give them some relief and comfort in regards to how they might be ensuring that their households are clean. We've had supplies for elders. We've also initiated what we call On the Land program, where we have provided individuals, couples, and or families during the spring, summer, and fall to get back out on the land, as we call it. Indigenous people, we spend a lot of time out on the land, either at the coast or in this large delta that we have here, which is about 18,000 square kilometers. where people have their camps, cabins, cottages, whatever you want to call them. But this is an opportunity where we saw a lot of family bonding with not only parents, but with grandparents and children and grandchildren, as well as enhancing their life skills out there. Also to give them opportunity to get back out and live more on the land with nutrition from there, making it a healthier opportunity, but also getting away from the communities. That was something that we saw a lot of stress and anxiety of people in the communities that we're remote, but knowing that if this pandemic gets into one of our small communities, it's going to spread quite rapidly. So there was the concern there. We were interested in the federal government's announcements in the past on different mobile camps. I can't remember the proper term, but we thought these would be medical camps that would be mobilized if there was a pandemic outbreak in one of our remote communities, where a medical team would go in and use these camps for different testing and isolation purposes. We've also provided kits to 5 different age groups, activity kits where 0 to 3, 4 to 6, that sort of age groups, all the way up to 18, with different reading, writing, arithmetic, science activities within those kits. We see that as a need to keep them occupied and busy, and we'll be looking to do that again as we move forward, because like I said, we're in a cold, dark period of the year now, so people are going to be spending a lot more time inside. Housing is a significant issue that we have. We have been working with the federal government to try and alleviate housing issues within our region, as well as across Inuit Nunangat. But the overcrowding is a significant issue in all areas of the north, and that's where the large concern in regards to potential pandemic spreading quite rapidly is a major concern. I would support the previous presenter in regards to the need for improved bandwidth. That has demonstrated, this COVID has demonstrated the real dire need and the lack of infrastructure throughout Canada's north. I would also support the comment in regards to the need for more rapid testing, especially in these isolated areas, because we don't have large hospitals or large medical teams that are easily available or ready. We have small nursing centers where some of these communities have 2 nurses. My community is the hub, so we have doctors here. But again, the other concern is testing, the potential for burnout in regards to the volume of people that they're having to see.
Thanks, Mr.
Also point.
I'm sorry, Mr. Smith. We're right at time now. Perhaps your next points can come up in a round of questioning. And sorry for the.
That's fine. Thank you.
Okay, and I know we'll be back with you. So, next we have for 6 minutes Mr. Nick Vauden, the President and CEO of Perimeter Aviation LP. Please go ahead for 6 minutes.
Good morning, everyone. Thank you for the opportunity. I'll just give you a quick overview. So I'm Nick Vauden, President and CEO of Perimeter Aviation LP. We are a remote aviation operator in northern Manitoba and northwestern Ontario. We service predominantly passenger, charter, and freight needs to about 30 remote communities in northern Manitoba and northwestern Ontario. We've been in business about 60 years with bases in Manitoba and Ontario, about an 850 employee size company pre-pandemic, of course. So obviously been a very challenging 9 months here. Working with our long-standing partnerships and relationships with our First Nations communities, we have put in a number of protocols right at the onset of the pandemic, from cleaning and flight segregation to thermal read, temperature reading equipment, and you name it throughout the pandemic. We have worked with each individual community and their either rapid response team or their pandemic leads to assist with pre-approval processes and any avenue that we've been able to assist these communities do their best to keep the virus out of the community, and when it gets there, to meet the needs safely. Some of the key challenges that have happened throughout the pandemic in the north are obviously the passenger volumes have reduced so much that it becomes very difficult for us to maintain viability of operating these routes. But since most of the time we're the only carrier and we have long-standing partnerships, we have elected to continue to operate these routes in order to get essential medical supplies and the members of the communities out for medical appointments and to just help meet the needs of the community. Some of the key challenges that we've tried to help them with are, and some of the previous speakers have spoke about, are hospital infrastructure, medical shipment movement. Seems to be a challenge in these communities with really only small nursing stations and no hospital features. The rapid testing is an immediate need and is starting to roll out to a lot of the communities. The problem is they are the vials that operate the rapid test are in such scarce supply that they can't use them for really rapid testing means. They're only used in close contact situations up until this day. So the program is moving, but that's a real sense of urgency. I think the next most important thing that we can do for these communities is set up the vaccination program to, prioritize the high-risk individuals and how we get it into the communities to limit the spread, because lots of these communities have unfortunately experienced cases in the last 60 days. As for the recovery initiatives that we would like to talk about, and really they somewhat echo the previous speakers, the internet and telecommunications infrastructure is still very poor in most of the communities. Slow, high-speed internet or no cell phone service at all. That would really assist, particularly in a time like this where we still have communities that have no high-speed internet at all. The healthcare facilities are very small-scaled with limited resources in the communities. So they require a high degree of daily movement for whether it's medical shipments or nurses or patients to come back and forth. They're really not set up with the adequate supplies to handle anything of this magnitude or even a small measure that could happen. The other item that we are really leaning on for the recovery portion of our strategy is the housing piece seems to be very challenged in the north. They're crowded. Lots of areas still don't have running water, and very tough for them to have a healthy lifestyle in this environment, especially when a community could be in lockdown right now. So those are kind of our three key long-term items. And I think that's really it for our overview.
That's good. Thank you. That brings us to time, so that's great. Appreciate that. And that takes us to our round of questioners. We start for a 6-minute round with Mr. Melillo and shared with Mr. Viersen. Eric, please go ahead.
Thank you very much, Mr. Chair, and I'd like to direct my questions to Mr. Vauden, and I am the Member of Parliament for Kenora, so many communities that the perimeter services and Bearskin airline service in my riding, as you know. Many airlines servicing the north have had to suspend service to remote communities due to the pandemic, due to financial strains, as you mentioned. And for these communities, it's really a loss of a major service and an essential service for many. I believe it also makes it more difficult for many of these northern communities to be prepared for the pandemic, for the second wave, and moving forward beyond that. So I'm wondering if, Mr. Bond, if you can speak to what the government has done so far to support airlines, and if you feel it's been enough to support the northern air carriers and ensure that northern communities are having the services and the resources that they need during this critical time.
Thanks for the question. Yeah, just to be quite frank, so we have had no subsidy to this day from the federal government, aside from the federal wage subsidy program that the entire country was offered. There is a subsidy program being pushed by both the provinces working with the federal government. That started really back in May and has not got to the carriers to this day. So to bluntly answer your question, we have not had the support. There is some momentum now to try to move that forward. And if we can get those lines of support, we will be able to move to phase 1 of the recovery plan, which would be reinstating some of this service that we've had to cut for economical reasons.
I appreciate that answer, and I appreciate the honesty. And back in, I believe it was April, I actually wrote a letter jointly with Mr. Pelowski, who's a government member of this committee, and we wrote to the many ministers and mentioning issues impacting tourism and seasonal businesses, as well as air carriers. And it's been unfortunate to see that the government really hasn't stepped up to support you. And I'm just wondering if you could speak a bit more with the limited time I have to the impact of service reductions in the north and as a result of this, and sort of speak to how air carriers can help to fulfill an essential role in pandemic preparedness going forward.
Yeah, so the impact has been quite large. We made the conscious decision as a company at the onset to not stop service to any community that was isolated and did not have road access or other means. So we took that on our shoulders with good faith that we would be able to get somewhere with the government to sustain any losses there. And as for the preparedness for the pandemic comment, we have a number of lanes in place with, particularly in the province of Manitoba and Ontario, to move medical patients, medical supplies, vaccines, things like that, that are ready and historically used throughout time, and even with recently with the flu vaccination movement. So there is a lot of lanes that are in place. They're just not tested and set up to handle this level of a scale or a pandemic like this.
Thank you. Just Mr. Smith, if I could go question you a little bit there. We also heard from Mr. Vauden as well, just around the rapid testing. Is that something that you would see valuable for the North around getting people tested? We hear about rapid testing that it can have results in under 20 minutes if you have a checkpoint as people come in to be tested. Would that be something that would be helpful for you, Mr. Smith?
I would say that would be extremely helpful. Where I reside, it still takes around 10 days for the government to get the results back just because of the remoteness. They have not, in any real sense, expanded their rapid testing outside of the capital of Yellowknife, where we see vast majority of the testing taking place and very little outside of that area. Like I said, it takes at least 7 to 10 days to get a result back. While the testing in that community is, like you say, I don't think it's quite as short as 20 minutes, but it's about 48 minutes, I think is what they say. But I mean, any expansion of that to at least the regional hubs like my community would alleviate a lot of stress and anxiety of the people in the communities just by knowing that the government is doing this outreach and enhancing rapid testing to some of their more remote communities, showing some care and concern, basically.
Okay. Would you make the recommendation to pursue the rapid testing more aggressively?
I would most definitely be recommending that because, like I said, it's pretty well non-existent. People have very high stress and anxiety. I did not point out as one of the services that we've been able to provide is professionalized psychological counseling made available at a long distance phone number for people if they need to talk to somebody that has that skill set as well.
Thank you very much. Ms. DeMoff, Pam, you have 6 minutes. Please go ahead.
Thank you, Chair, and thank you to all our witnesses for this testimony. It's been very helpful. Mr. Smith, I'm really disappointed to hear you don't have rapid testing. I know Indigenous Services has made rural and remote communities a priority with the Gen X machines, so I'll certainly be taking that back to find out why you haven't been included on that. Because all of the witnesses have talked about rapid testing, and I think the government recognizes the need to really ramp that up. Ms. Agrell, I had some questions for you. I'm extremely proud to have known the operating engineers for many, many years, long before I was a member of Parliament, and have had conversations years ago with Mike Gallagher, the business manager for Local 793, about the work you've done in training Indigenous peoples to work as operating engineers. You talked about the challenges and the barriers to training, and I was reading that you had developed a regional training center back in 2014 with Nishtandega. I'm just wondering, is that still in existence, and is that a model that could be expanded?
It's certainly still in existence. My understanding is that right now that community has had some serious water treatment and water quality issues and is sort of in a bit of a evacuation state right now. Certainly, yes, that sort of organization and bringing it into the communities is something that we're continuing to try to support. Most of our training is based in the South, and we do what we can to facilitate people coming to us. We've been working a long time to get the equipment, the area, the location, the ability to transport the equipment up north and closer to where people actually need it. So those sorts of initiatives are certainly something that I think are worthwhile and worth pursuing to keep people close to home, both for pandemic purposes and for sort of economic driver purposes.
So would it make sense to have a training center in the north? I mean, I know you've got one in Oakville and in Morrisburg, but I mean, I've seen the one in Oakville. If, for those that don't know, you're the large crane operators. You need an awful lot of space to operate one of those, or is that not practical?
It's a great idea, and it's something we've been, I think, working on for a long time, because just getting the amount of equipment necessary into place, it's big, heavy, expensive equipment. You need earth to move around, you need space, and if you want to be able to transport it and move it around in the north, you also need the ability to sort of move it. And the costs for that, for sort of private organizations or for employers to sort of sponsor, have to date, as I understand it, made it a bit impractical, but it's certainly something we're continuing to look and push into. And I know there's people in our training institute who are more knowledgeable than me on sort of the steps they've been trying to take to do that have all been rather interrupted and thrown into chaos by this last 9 months.
So you mentioned 15% of your workforce at Baffin Island were Inuit. Overall, what percentage of your workforce are Indigenous? Do you know?
We don't, and that's something we've been talking about because it's never been something that we track, any of our members, sort of their
Right.
heritage voluntarily or not. Historically, it's not been. Our training side has been better in that one because they really target programs towards Indigenous people, particularly, and work with the groups. But overall, our membership, we don't really know that. We know it for the North because of Inuit impact benefit agreements and conditions like that. So I really can't say. I can look into it and see if I can find out, but I suspect we don't even have the numbers for you. It's something we know is growing and that we're continuing to work on. We're continuing to see more wholly owned Indigenous businesses in Ontario, but about even anecdotally, that's a small number and taking time to grow.
Okay. Mr. Bowden, I had a question for you. There was a fairly significant amount of funding announced in the fall economic statement yesterday for regional airlines. And I'm wondering if you've had an opportunity to see that and if you think any of those dollars will be of benefit to you.
Yes, I was aware of that. I have reviewed it. I do believe that is the package that the federal government is working with the provinces for and working with air carriers like ourselves. So I do believe within the last 45 to 60 days, we've really got some balls in motion there working with our provincial governments who are working with the federal government for deals
Okay.
on that.
Okay, that's great because when I look at the numbers, they're fairly significant, but it's always important to make sure that they're getting to the right places, right? And they're serving the needs that. So you're still part of those dialogues, then, are you, or the
Absolutely.
conversations going on? Okay, that's great. And then, Mr. Smith, I only have very little time left, but you had to stop your presentation, and I just wondered if there was anything else you wanted the committee to know that you didn't have time to get on the record previously.
No, thanks for the opportunity. I think I would agree with Mr. Vauden's view. We have a lot of remote communities in our area, and they're only accessible by one ship a year to get their annual supply and/or by aircraft. And we have been able to get the airlines in the region subsidized to make sure that this essential services was provided. It was right down to one flight a week for a while there, but the services have ramped up to 2 or 3 to some of these remote communities. Thanks.
Thanks very much. Thanks,
Thank
Mr.
you.
Moff. Madame Bérubé, vous avez la parole. 6 minutes, s'il vous plaît.
Merci. Excusez. Thank you, Mr. Chair. I'm the member for ABTB. So my question goes to Mr. Vauden. I understand very well the difficulties connected to air transportation. So what measures have you taken for your company to limit the spread of COVID-19?
But I think I caught most of it. So from the onset, some of the measures that we put in ahead of any regulatory requirements, we immediately went to mandatory face coverings. We bought thermal image scanners to accurately scan every passenger before they were checked in to make sure the temperatures were in place. We implemented, we bought a bunch of fogging equipment actually in February as we saw this coming, that we fog all the aircraft and all the facilities in between flights. Any communities that are a flight that does 2 communities, we put segregated waiting areas in place. We boarded the airplane separately so that the communities weren't intermingling. I'm just trying to go through my notes here. We provided sanitizer and PPE to all the passengers traveling, and we worked with each community for pre-clearance on passengers so that the communities could actually see who was wanting to travel before they traveled and make sure they had pre-clearances done. We have a list of items that we've done for each community.
Vous avez parlé aussi que you also said that you had 850 employees before the pandemic. So now, have you had to cut your staff following the impact of the pandemic?
We've continually adjusted the size and scope of the organization throughout the pandemic. I couldn't give you exact numbers now, but it has gone up and down and up again, you know, with each wave of the virus, and depending on the jurisdiction that we're operating in, how, you know, that largely affects the size of the operation.
When we talk about the pandemic, which would end someday, and we will come back to some sort of normalcy, can consumers expect an increase in airfares, the price of air tickets?
That I could answer that yet. I do know that, you know, there's been some increases from some of the airports and Nav Canada. That's really the only thing that I see coming or see that's currently in place. So those are the two areas.
My question now is for Mr. Smith. Earlier, you said that in your community, you helped with cleaning, you provided food baskets, support with seeds. When it comes to funding, what support did you receive from the government to help you help your communities?
We received approximately 5.8 million to deliver all of those different services and programs and kits, etc.
Good. Ms. Agrell, you also stated that you need support when it comes to construction, boil water advisories. Is there something you'd like to add?
Sort of keeping an eye on the work and the progress of work that's been going on, and we're certainly encouraged that some local businesses are being formed and doing that work. Obviously, there's more to be done, and we just want to make sure that it continues, and to the extent possible, using Indigenous workers and ideally our workforce, our members, to do the work.
You also said there are problems related to training. You want to avoid a situation where people get the virus. So what solutions can you propose to ensure better training?
As I think I said, keeping training or making communities more self-sufficient with more accesses to resources closer to where they're at, ideally sort of in the north or in remote communities, certainly helps and reduces movement between communities, keeps sort of the knowledge local and able to sort of rely on itself without having to move long distances, which is disruptive to young community members, even outside of times of pandemic.
Merci. Thank you. My next question goes to Mr. Voden. We said air transportation is essential to northern and indigenous life. Will it be preferable to carry out extensive consultations with all stakeholders who depend on air transportation services?
Absolutely. I think that would be important. I think that's process that started at a very micro level, and we're working with each community and the provincial governments to get that program going right now.
Dans un mémoire aussi soumis à notre comité NATA, soutient.
In a briefing to our committee on the intensification help for airline or airport infrastructure to modernize the landing strips. So what should the money be used for from within that program as a priority?
Go ahead.
You know, I think that's, as we progress through the pandemic, I think the landing strips are important, and the infrastructure at the airports. But currently, any infrastructure we can provide rapid testing, the vaccination program, supplies to these communities, I think is vital.
And thank you very much. Thanks, Madam Berube. Ms. Blaney, you have 6 minutes. Go ahead.
Thank you, Mr. Chair, and I want to thank all of the witnesses here today for your testimony. It's been extremely informative. If I could start with you first, Mr. Smith, you talked earlier in your testimony about your concerns around burnout for healthcare folks and the incredible work that they're having to do during this time, and the fact that so many in your region don't have a lot of health professionals. You also mentioned very briefly about the psychological support that's been available for people. I'm just wondering if you could talk a little bit about the concerns you have around burnout, and I just want to recognize that so many community members and everyday people are also struggling during COVID. So you sort of have two levels of burnout, just everyday folks and then the professionals trying to care for them. And I'm just wondering about the resources that are available and how you're working collaboratively to manage that burnout.
We thank you for the question. We're our own Indigenous government, so we do provide these types of additional services to try and alleviate the demand on the health system within the region and the territory. A lot of the medical staff here are transient, so they will come up from one of the provinces. A doctor and even some nurses will come in on rotation for say 8 weeks at a time. But when they go back to wherever they're coming from, they're still continuing to work. So there's that demand and pressure that's still on them on a daily basis. So we're trying to provide other services, home care workers, where they can go into the households to check on elderly or those that are in need of that type of service. We are able to provide that as well. I also mentioned the counseling services. We've done that in the past, so we have a lot of experience providing that due to residential school issues. That's where we provided those supports. So we're looking at any and all means. Like I said, we're providing medical kits to the households as well. We're rubber gloves, masks, first aid kits, hand sanitizer. These are a part of these kits that we're trying to get into the household so that they have this readily available to them as well. It is difficult at times to find some of this material, but we're trying to get as much as we can to get into each household.
Thank you. And you spoke earlier too about the incredible work you're doing around providing kits for sanitization. And of course, one of the challenges you talked about, Mr. Smith, was overcrowding and lack of housing. So I'm just wondering if you could talk about what you're doing to help households stay as clean as possible. And if you do have someone who is diagnosed with COVID, if you're able to isolate them or if the overcrowding is a significant challenge.
People are, when they do return from outside of the territory, they're expected to isolate for 14 days in a major center such as this community. And then they're allowed to go home after that. So that hopefully they don't contract COVID and then bring it back into the household. That's why there's such a long length of isolation that's required. Initially, we did provide cleaning materials such as hand soap, J-cloths, Clorox as an example, bleach, Mr. Clean. These were part of the cleaning kits that we provided to the elders' households. We saw the interest from others, so we're able to start to put a second approach for these kits together. If there is an outbreak in any of the outlying communities and this community as well, the infrastructure will not be able to manage it. That's why I was pointing out the mobile camps and our interest in how ready either this territorial government or the federal government or the military would be able to respond in a timely manner to get into one of these communities, to isolate the issue and start to address it as soon as possible.
Thank you. My last question to you, Mr. Smith, is just around you talked about dealing with the dark time, and of course, you had some solutions that put people out on the land and did all that amazing work. But now you're having to face this other challenge of people having to stay home in these isolated houses, or in these houses that may not be sufficient for their needs. I'm just wondering how you're preparing for that period of time, and sort of what are your biggest concerns?
Again, thanks for the question. We're trying to look at the kits again for the youth. The education system only restarted physical fitness again just this week. So that was a concern that's been raised by the communities in regards to the lack of opportunity for children to be active and exercising, not only physically, but mentally as well. So we're looking at putting kits together again that we could provide to as many youth as we can, as well as other things, like I pointed out earlier, the sewing kits for those that want to do that. But it's little things like even puzzles. We can purchase puzzles to get into the households. That's a way of keeping people occupied, and hopefully families of all ages will be taking part in that. So it's building life skills and family bonding at the same time. But that's the sort of things we're looking at.
And thank you very much for that. And thanks to all of our panelists. Unfortunately, we were shortened due to technical issues, but the testimony is remarkable. And as much as we have technical issues, I think it's just great that we're able to speak to people across this great distant country of ours. And your technology worked just fine on the Alaska border. Ours didn't work so well here in the House. But once again, thank you to all. We're going to suspend just briefly while we set up our next panel, and then we'll be back. Thank you. Our meeting with the second panel. And so this meeting I call this meeting back to order. And with us by video conference for the second hour are the following witnesses: Mikkel Robertson and Marjolaine Seeley, executive directors from two commissions of the Assembly of First Nations Quebec-Labrador. Dr. Nell Weeman, President of the Indigenous Physicians Association of Canada, and Christopher Shepherd, the President, and Jocelyn Formsma, Executive Director of the National Association of Friendship Centers. And welcome to all. We now have 6 minutes for each of the witnesses' opening statements, beginning with the Assembly of First Nations Quebec Labrador. Who would like to start for 6 minutes? Please go ahead. Muted. Ms. Seeley, you're muted. Could you unmute? There you go.
Okay, sorry about that. Okay, thank you. So, je vais faire ma présentation en français.
My presentation will be in French. Thank you for inviting me. We want to recognize the unceded territory of the Algonquin, the territory where we are meeting. I joined my Wendake community, and I know I'll be presenting my presentation with Michael Robertson, who will be presenting some of the issues that are also opportunities for us to collectively work together to relaunch the economy and improve the health situation of our people. And the examples we'll be presenting today come from a study that was done by the Assembly of First Nations of Quebec Labrador. When the First Nations people throughout the country are faced with major health stakes, there's a need for consistency. In spite of the investments made to support businesses and communities from the beginning of the pandemic, it's been very difficult for many of these communities to be full stakeholders and in participating in the economic recovery without the support of the federal government and provinces and territories, something that is essential in all relations with the First Nations. As you know, the health of anybody depends on determinants of health. So we would like to obtain telemedicine services, health professionals, and social services, as well as teachers, so that we maintain contact and end isolation and distress. To offer quality health services, we need to invest in developing supports and coming up with digital information services for First Nations. We see today that the policies we have cannot ensure adequate sharing of information, nor can it guarantee the health determinants for our population. We need to reinforce our governance and make sure that there's better oversight, better management of the information resources we have. There's also overpopulation, lack of housing and infrastructure. For example, we need to increase the number of residents for elders, who are our custodians of our culture. This has been raised many times. There's also lack of staff, the need for training, and low salaries. In spite of efforts and investments made, we continue facing many obstacles to access individual protective equipment and to get First Nations involved in decision-making processes when strategies are set up to provide supplies. We mentioned that a while ago. And also when it comes to vaccines, which were expected, though the federal government has recommended that provinces and territories work together with First Nations, we need the right communication strategies so that we educate our people as to the advantages of a new vaccine. Lastly, lots of essential workers have talked about the vulnerability they feel working as first-line workers. And there's also the health network that is getting weak. We need to plan for the future generation, make sure that the right people are trained on cultural practices. These issues raised could be seen as opportunities, but we need a political will, and everyone should share the issues. Now I'll give the floor to my colleague. Good afternoon. Lack of housing amongst First Nations and overpopulation are problems that have been there for a long time. They were there before the pandemic, and the last few months have shown that it's essential. A study carried out in Quebec, Labrador has revealed that there's a need for more than 10,000 residents in Quebec localities, and many of them have to be improved. But during the last meeting of the Tripartite Committee on Housing, the Regional Bureau informed us that the social housing program had been reduced under Article 75, an 8% reduction by next year. So less houses have been built. We also realized that the construction costs have increased over the past few years. The number of units that will be constructed next year will also drop. And this is difficult to justify during a pandemic. The housing crisis for First Nations makes them very vulnerable, and this has been worsened by the pandemic. We need to explore all avenues to increase the housing capacity of First Nations. Investments dedicated for temporary infrastructure could be used as shelters. Homelessness is not only in the urban areas. We've seen this in our local communities. So we need to come up with a rapid housing construction strategy. We need measures in the many communities that are not urban centers. So a strategy that is targeted is necessary. We recommend that the Quebec strategy in this Bill 66 should be copied. The announcement yesterday is an encouraging first step. We need to build houses for our elders, and this would help resolve issues for those who have been waiting on our waiting list. We also need high-speed internet in all our communities. The health of our people depend on it. The interpreter wishes to say that the speaker is speaking very fast. The government must...
We're way past time. We'll pick up any points later on through the conversation. And for all of our witnesses, if we're not able to...
Il n'y a pas de traduction.
We don't have translation? Translation okay?
Okay.
Okay. Any points that are missed in the conversation can certainly be submitted in writing if we miss something. But now I'm going to offer 6 minutes now to the President of Indigenous Physicians, Dr. Weeman. Please go ahead for 6 minutes. Dr. Weeman.
Bonjour, Ani. I'd like to thank the chair, vice chairs, and members of the Standing Committee for the invitation to appear before you. My name is Dr. Nell Wyman, and I'm originally from Little Grand Rapids First Nation in Manitoba. I'm a psychiatrist by training and the current president of the Indigenous Physicians Association of Canada, also known as IPAC. I also work as the acting Deputy Chief Medical Officer at the First Nations Health Authority in British Columbia. I am joining you from the traditional, ancestral, and unceded territory of the Coast Salish peoples, the Musqueam, the Squamish, and the Tsleil-Waututh. These are some of the key messages IPAC would like to convey regarding support for Indigenous communities and individuals as we are going through the second wave of COVID, organized around various themes. About IPAC, the Indigenous Physicians Association of Canada is the national representative organization of Indigenous physicians, residents, and medical students. We have approximately 250 members studying, training, living, and working across this country from coast to coast to coast, though we also know there are other Indigenous physicians and medical learners out there. IPAC members have a collective intent to collaboratively use our skills, abilities, and experiences to improve the health and wellness of Indigenous peoples across the country. This includes advocating for individuals, families, and communities who have experienced COVID-19 infection and outbreaks, those who remain at risk of infection, and who are at high risk of experiencing severe courses and outcomes related to COVID-19 illness, including death. However, IPAC cannot represent the many diverse views of all Indigenous people across Canada, in this instance regarding the supports needed as part of the response to COVID-19. During the COVID-19 pandemic, Indigenous physicians have participated in the response in a variety of ways, as primary care providers on the front lines, in Indigenous, urban, rural, or remote communities, either in person or virtually, as specialists working in communities or in hospitals, including academic teaching hospitals, as public health physicians contributing to the COVID-19 response in cities and health authorities, as administrative and medical education leadership at health organizations and universities, and also in governments at the local, regional, provincial, and federal levels. We have also created a series of public service announcements, 5 altogether, which feature 8 to 10 Indigenous physicians from across the country. The PSAs convey culturally safe and relevant information on themes important to our communities and nations during COVID and highlight our Indigenous strengths and resilience. IPAC members have also served during the pandemic on various committees and advisory groups, including the Public Health Agency of Canada's Health Professionals Forum, and on more focused initiatives such as providing review and input into developing Canada's COVID-19 immunization plan. We respect all Indigenous people's right to self-determination. Support for First Nations communities should recognize and reinforce First Nations self-determination and systems of self-government. One example is the ability of communities to declare closures and/or limit access during the pandemic. Communities also express self-determination and the capacity to assess or declare their need for funding for emergency measures. Such a decision should only need to come from the community itself, and there should not be an additional layer of verification required from an external body. IPAC continues to be concerned about the health and wellness of Indigenous people across the country during COVID. We are especially concerned about the mental health and wellness aspects and note the particular challenges when there is concurrent substance use. In BC, we are dealing with dual public health emergencies, COVID-19 and the opioid crisis. And we are seeing that the significant rise in overdose events and deaths are particularly tragic, unintended consequences of the imposed public health measures to reduce the spread of COVID-19. Indigenous people are unfortunately overrepresented in the overdose crisis. We are supportive of increased funding for harm reduction services, treatment programs, and building up capacity for establishing a safe supply in order to separate people who use drugs from the toxic street supply. IPAC draws particular attention to the capacity of Indigenous communities to access health services, including primary care, virtual services, and to timely COVID testing, which has been mentioned already. There are long-term investment needs, including medical transportation and infrastructure, internet access for telehealth, necessary medical equipment, technology, and supplies. The pandemic has only highlighted the disparities in health services to Indigenous people. There is also a need for sustainable, healthy homes. COVID-19 thrives in inequity. During the pandemic, the overcrowding and poor condition of some homes means that self-isolation is impossible and the spread of the virus within a family group inevitable. Given the past harms and devastating experiences of Indigenous people during pandemics, historically and in more contemporary times, it is important to clearly articulate messaging around COVID-19 and the public health response. For example, we are concerned about vaccine hesitancy when one becomes available, in part because of Indigenous people's past experiences with medical experimentation and poor treatment. We do advocate for Indigenous people to be a high priority when vaccines become available, given their health and exposure vulnerabilities. Indigenous people want access to their own health systems, including funding for elders, traditional medicine people, and healers. Many of us see this as vital to their own health and well-being. And finally, yesterday's release of the BC Provincial Inquiry Report into Anti-Indigenous racism in the health system in plain sight reminds us that we have a long way to go to create a health system for Indigenous people that is safe to access during the COVID-19 pandemic and beyond. Thank you. Merci. Chenagwich.
Thanks very much, Dr. Wyman. And now, Christopher Shepard and Jocelyn Formsma from the National Association of Friendship Centers. 6 minutes. Please go ahead.
Thank you, committee. Good afternoon or good morning in Saskatchewan. I'm Christopher Shepard. I'm the president of the National Association of Friendship Centers. I want to recognize that I'm joining you today from Treaty 6 and the homeland of the Métis, and I'm so thankful for the welcome that I've received while being a visitor in their territories. As is customary, I'm here with Jocelyn Formasma, who is our executive director, and we'll field questions jointly and try to answer as many of them as we can. I want to thank you for the invitation once again to appear before you today on the timely topic of support for Indigenous communities, businesses, and individuals through COVID-19. Due to our previous testimony to this committee, you are already aware that the NAFC represents over 100 local friendship centers and PTAs in every province and territory in Canada, except for Prince Edward Island. Friendship centers are urban Indigenous community hubs that are owned and operated by Indigenous people and provide a wide range of programs and services for every age and demographic of people. We offer services in justice, health, violence prevention, housing, homelessness, economic development, entrepreneurship, employment and training, children and youth programming, education, languages, culture, sports and rec. Collectively, we are one of the largest and most comprehensive service delivery networks in Canada, and not just for Indigenous organizations. While the pandemic was declared, friendship centers rolled up their sleeves and got to work. Having to pivot quickly, we moved on collecting items, food, supplies, protective equipment, and began delivering kits to community members. We had friendship center staff cooking food in their own homes to package and deliver, staff and volunteers going out to pick traditional medicines to include in deliveries. Delivery of these items also allowed friendship centers to check in on community members to see how they were dealing with the pandemic. In one instance, a friendship center discovered that a family had a broken stove. The friendship center arranged for a new one to be delivered to the family so that they could cook their own food. Friendship centers rented hand washing stations, portable toilets to ensure that people had access to sanitation, especially those who were unsheltered. Friendship Center outreach workers have been ensuring that unsheltered or homeless members of the community knew about what Indigenous specific sports supports were available. Friendship Centers have spearheaded or joined COVID-19 joint task forces, worked with numerous other community organizations to ensure a joint response and collaboration. We have secured and delivered over 400 tablets and distributed them across the country. These tablets went to children and young people for school, families for work, seniors to reduce isolation and foster connections, and to Friendship Center staff to transition to providing online supports. We are so proud of the way that our members network has stepped up and stepped forward in these times, and our work has not come without challenges. As urban Indigenous organizations, we experienced what continues to be an ongoing jurisdictional wrangling that has been noticed since the beginning. Between the federal and provincial governments, neither stepped up early to provide support specific to urban Indigenous organizations, with each inquiring to us about where the other level of government was in their contributions. Once Friendship Centers did receive funding, there were misunderstandings about what the funding was for. While Friendship Centers applied for and received funds to provide community-wide supports, we received many calls for individual or family financial support. Despite these challenges, Friendship Centers' responses have been quite incredible. And while we do not expect the level of service to decline anytime soon, in fact, we expect it to increase over the next 4 to 6 weeks as the holidays are close. We are also looking to the future. Current funding is set to end on March 31st, 2021, and we are gravely concerned that the community supports that people are now relying on will not be able to continue into the new fiscal year. We forecast that the current levels of support, eventual vaccine distribution, and then the building back better phase will require heavy engagement with urban Indigenous people, organizations, and communities. Indigenous people are a priority population in this pandemic, and we need to ensure that urban Indigenous people are not left behind. The NAFC has offered and continues to offer its perspectives, expertise, and knowledge of urban Indigenous communities and community members to the federal government to help inform them and guide effective remedies both now and as we continue on this journey. We look forward to being part of the ongoing conversation and continued investment in this work. Thank you so much.
Well, you had a whole minute left, but we appreciate that because I know that our questioners are eager to speak to you. So now we have Vice Chair McLeod. I have you up along with Mr. Vidal for a 6-minute questioning round. Please go ahead.
Thank you, and we're certainly happy to take the extra minute, Chair, as I share my time. Thank you to all the witnesses, and it's very important testimony in terms of, supporting a committee report with some recommendations to help the government move forward. I do actually want to start my questions with Dr. Wyman, and this is something that you didn't address, but is, something that I have been wondering about and is a concern, and that is the issue of the caregivers that you represent, the physicians who are working in very challenging circumstances with no end in sight. And have you contemplated, is there any supports or things that would be helpful in terms of, the burnout and the tremendous stress that the caregivers and the physicians must be under, especially those on the front lines?
Thank you very much for that question. Yeah, there were probably many things I left out of what I was able to share in 6 minutes, but that is really an important issue that you raised. I know from speaking to some of our members who are working on the front lines that burnout is definitely an issue, and not just for physicians, for the nurses, the health directors, etc., all the different sort of frontline staff working in our communities, and even for the Indigenous physician members, such as myself, who work in public health. This has really been a challenge to address in terms of human resources. So we have to remember that we ourselves are experiencing the pandemic as well as working on aspects of healthcare during the pandemic. But I haven't actually heard of anything specifically for that, for caregivers who work with and on behalf of Indigenous communities. I think that's a really important point you raise, and also very necessary. And I can definitely speak from personal experience about the need for something like that. That would be amazing. I do know in my health authority where I work in British Columbia, we do have access to cultural supports, but that may not necessarily be the case for other caregivers across the country. Thank you.
Thank you. And given that I'm sharing my time, I'll turn it over to my colleague, Mr. Vidal.
Thanks, Kathy. I've got a couple questions. We'll see if we can get to two, but I'll get to the first one first for the National Association of Friendship Center folks. So Christopher and Jocelyn, if you would. I was in Ottawa last week, and I raised with Minister Miller the concern about a lack of data, and especially as it relates to urban Indigenous people. This is also something I raised at this committee way back in April. And Christopher, you talked about even the jurisdictional wrangling that goes on with the people you folks represent. And I guess our suggestion is it's time for kind of a coordinated effort, especially maybe as it relates to the rollout of a vaccine strategy. Sorry. I also raised the point that I think vulnerable people and communities must be a priority as we consider how this happens. So my question for you is actually quite simple. Has your organization, or have you, in your engagement with the government, have you been able to be involved in discussions around the lack of data, for one, or the rollout of a vaccination strategy as it affects urban Indigenous folks?
Thank you, Mr. Vidal. So for us, as most people, if you've seen me and Jocelyn presented any federal committee, the lack of urban Indigenous health data and other sources of disaggregated urban Indigenous data in Canada is, I guess, at minimum shocking, because what you don't know, you don't know. But what we do know is that urban Indigenous people make up the majority of Indigenous people in this country. So you actually don't know how to connect with them, how to support them, what things you need to be doing, health policy. We've been working specifically with Well Living House on data and maybe a health data strategy nationally, because no one is doing it. And if the governments can't figure out the jurisdictional issues and figure out a way to collect that data, then someone else is going to have to. And so for us, while we wait for the governments to figure out whose jurisdiction it is to count people, we're going to work with our Indigenous physician partners and health centers to figure that out in the meantime. Because when you're on the ground in urban communities, it's kind of shocking that people aren't paying attention to the basic idea that this is where most of us are. For the vaccine specifically, Jocelyn can answer that, and so I'll toss it to her to finish.
Yeah, just quickly on the vaccine rollout, we've been in conversation with Indigenous Services, the First Nations Inuit Health Branch, as well as the Public Health Agency of Canada, just to kind of get in early with some of those conversations. Now it's kind of the same issue that the rollout of the vaccine will happen provincially. And so in some of the guidelines that Provincial Health Agency the Public Health Agency of Canada is developing, we're just trying to ensure that they are inclusive of urban Indigenous when doing their planning, especially to get the vaccine out to Indigenous people. We're especially concerned about some of those more vulnerable folks who may not feel comfortable accessing mainstream health services. As President Wyman mentioned in her opening remarks, we're experiencing the same thing. And so we're trying to see if there's a way to see if they would like to utilize the Friendship Center network. We just need to know as soon as possible so that we can be clear in about the kinds of resources that we would need and the capacity that we would need to be able to support that kind of rollout. We've got halls, we've got gyms, we've got parking lots that community members may feel a bit more safer coming to than a mainstream health clinic or however the rollout is. So all we're asking them is just to be upfront in keeping us engaged sooner rather than later.
Thank you very much. Adam Van Couverden, 6 minutes, please go ahead.
Thank you very much, Mr. Chair, and thank you to the witnesses for joining us today. It's an honor and a privilege to hear from you. My question, the first part of it, will be for Dr. Wyman. Dr. Wyman, I had the honor and privilege of meeting Dr. Nadine Caron, who I'm sure is maybe a colleague or a friend or somebody that you've heard of. She was one of the most inspiring people that I've ever met, so I just thought I'd make that connection here and pass that along. My question is regarding the $631 million that was announced yesterday in the FES for enhancing public health measures in Indigenous communities. It sounds like a lot of money, but it's also a huge issue, and it requires a tremendous amount of work. So the implementation of these monies is more important than the total investment. But the intention is to help mostly seniors who will be most severely impacted by COVID-19. And it says that the measure should help to prevent and contain the spread of COVID-19 in Indigenous communities. And I listened to your testimony today and just listened to about how absolutely critical and important that is. But I just wanted to highlight that amount as being, large, but the problem is bigger. So I'd love to hear your input on implementation of this funding and what needs to be done to ensure that it actually achieves the goal.
Thank you for that. Just quickly, I'll just say that I get a chance to interact with Nadine quite regularly. So Dr. Caron, sorry. So thanks for that. I'll say hi. I think the one thing that's really important to, emphasize is that our elders, our people in the older age ranges, including our elders, our language keepers, our knowledge keepers, are a precious, irreplaceable cultural resource. And I think that's part of the reason why there's a lot of anxiety in different communities, urban, rural, remote, about trying our best to protect our elders 19 as best we can. And I think, part of my response is based on the context, the BC context in which I'm working, is that, communities themselves have, and communities and groups of communities and nations have their own kind of pandemic plans that they would like to be able to enact in order to slow, reduce, and prevent the spread of COVID-19 in their communities, and that includes very much protecting elders. And ties in, I think, to some of the testimony you've already heard earlier today, even in the session before this one, around providing basic comfort measures, the ability to maintain cleanliness and sanitation in the homes regarding the virus, and then pure mental health, things that would help with everybody, but in this case, older people and our elders' mental health. We're quite concerned about the lack of ability to connect with one another during this time, being physically distant while remaining emotionally and spiritually connected. So as you say, I think, it sounds like a lot of money, but once it gets distributed or allocated, it'll be interesting to see how communities have those ideas for how they would like to invest those funds. Thanks.
Thank you, Dr. Wyman. With any remaining time, I'd just like to focus on the money that's going to, also from the FES, for territorial isolation hubs. And this is, I would love to see, a hub of this sort, if it's an infrastructure investment, be reutilized eventually as something that's such a valuable piece of infrastructure, because we know that places to meet, places to play, places to gather, and certainly housing are all in short supply in the north. But your experience or your thoughts on these so-called isolation hubs, if you have any insight or perspective on this investment?
Thank you for that question. And I'll do my best because my knowledge is really relatively limited around that. But I think some of the other people who have provided, their experiences today at this meeting recognize that at times self-isolation, for example, in family homes is not feasible or anywhere near possible because of issues such as overcrowding and just the small space and relative limitations of a particular home. So there is definitely, because I work in public health on my day job, when new cases arise, we're always interested in working with that particular person and their family to ensure that they have a safe place to go to have their self-isolation period, and that includes for people who are deemed to be close contacts. So certainly any investment to be able to be helpful to people in those situations is necessary and needed. Thanks.
10 seconds.
Okay. I'll
Thank you.
Let it catch us up. Thank you.
Okay, thanks so much. Madame Bérubé, 6 minutes.
Merci, Monsieur le Président, et merci à tous les témoins présents.
Thank you, Mr. Chair. I'm from IBTB. My question is for Ms. Sui. A while ago, you talked about economic recovery, what is happening with the First Nations. There were major issues. In your opinion, how did the federal government support you, and how more can they support you overcome this pandemic?
On vous entend pas.
We can't hear you. We can't hear you.
Vraiment désolée.
Merci.
Les investissements qui ont été mis.
The investments made so far have helped all communities. Conversely, when you look at the persistent issues, we talked about housing, temporary housing. It takes resources to build. And to build for the future, we need resources that would remain permanent. On our side, we think that leadership was taken by communities, and this contributed to minimize the spread of the virus. It's certain that another problem raised a lot is the fact that all police services are not being considered essential services. Several communities still need to use provincial police services. So we need to revive this system so that we help communities. Now, talking about funding, yes, we received funds for supplying some equipment, but when it comes to rapid testing and strategies that should be adopted with provinces, with the upcoming vaccine, there are still some issues. There are still jurisdictional conflicts, and I think that that's the way forward. Those issues have to be resolved. The last thing that is also important, and we talked about it, it's access to data. Several measures have already started, but we still need to strengthen those strategies to be able to manage our own data. Thank you very much, Ms. Sue. My next question goes to Mr. Robertson. When you said a while ago that there is economic catch-up that has to be done, what are you expecting from the government when it comes to financial resources to help with the economic recovery? Necessary funds, I must say that in terms of figures, when it comes to the economic catch-up for housing, we looked at what is needed. We think it could cost $4 billion. That seems substantial, but that's not necessarily what we expect. What we want, most of all, is that there should be a series of measures deployed to facilitate the catch-up. A while ago, I talked about constructing houses for the elderly. We need to be able to create space in communities and free up single-family homes. There's also houses for professionals. That will also be another great opportunity to help provide temporary housing and also, once again, free up single-family homes occupied by professionals working in the communities. In addition to all that, there's the issue of temporary housings for homeless people. If this had been deployed in advance, we could have found places to put people to isolate because of overpopulation. It's difficult to have them isolate in homes. If we had had something for homeless people. So we believe that in all these areas, the government could invest, and this could have a long-term impact in the community. This will create spillovers in neighboring communities as well, because as you have seen, we can't do that on our own. We need partnerships. So we think in our group, in our organization, that we have a great economic development opportunity here, not only in the short term, but also in the long term, because we know all the repercussions when it comes to health and socioeconomic indicators that are tied to health. So we see all these problems as an opportunity, and vulnerabilities exist. When we talk about needs, as we saw with the pandemic, when it comes to internet access, what is the situation there? Do you still need more resources and funding to help with internet access? Yes, we have many communities in the rural areas that have insufficient internet services. Of course, this increases the vulnerability of the population because they can't access telemedicine. Information is difficult to access. And all this increases isolation because right now, as you know, you must have noticed during even this hearing. So we have many communities that are excluded from these opportunities like this one. So clearly, this has an impact on vulnerability, health vulnerabilities, and economic vulnerability. Many businesses have continued providing services to their clients because they have access to high-speed internet. But in communities like us, which don't have such internet, they're excluded. I don't necessarily have a list for you.
Ms. Blaney, you have 6 minutes. Please go ahead.
Well, thank you, Mr. Chair, and I want to thank all the witnesses for being here today. Dr. Wyman, if I could start with you first, you talked about having a dual public health crisis, and I know I hear often from some of my constituents around the opioid crisis and what the challenges are that they are facing. I especially think of Darlana from Mom Stop the Harm, who's decorated a Christmas tree in memory of her son again this year. I'm just wondering if you could talk a little bit about how COVID-19 is impacting the use of opioids.
Thank you. Thank you for the question. Yes, so again, I'll speak a little bit from my context here as working as a public health physician in British Columbia. So we are dealing with what two declared public health emergencies. The opioid crisis was declared a public health emergency in April 2016. So it's been going on for about 4.5 years. And of course, the COVID pandemic is the second. And there we have seen a really tragic interplay between the two, especially during the early months of the pandemic when here in British Columbia, we went into lockdown. And what happened was many of the services available to people who use substances were either stopped for a period of time or reduced in terms of harm reduction services, access to overdose prevention sites, things like that. And combined with an increasingly toxic street drug supply that is, laced with very strong variants of fentanyl, carfentanil, and other even non-therapeutic substances like tizolam. People who even use recreationally can potentially die from an opioid overdose. So we have seen numbers over the time of the pandemic of overdose events and deaths that far exceed what we have been seeing over the last couple of years. So we're actually making some inroads into reducing the numbers of deaths of all British Columbians and including First Nations people. But because of the pandemic and that unintended consequences, we are seeing an increased number of deaths. I think we're on track to have the highest number of deaths due to opioid overdoses in British Columbia this year, and including for First Nations people. And we do currently have a higher number of deaths due to overdose than we do due to COVID-19. So it is a really, we find ourselves struggling to keep up with trying to respond to both at the same time.
Thank you so much. If I could now go to Mr. Shepherd and Ms. Formosa, or sorry, you have a name similar to one of my mayors, so I just called you by his name. I apologize. We've heard clearly in our office has had conversations with you about the resources that are needed and the fact that the minister's office is often referring people to friendship centers and they don't necessarily have the capacity to address those issues. So I'm just wondering about how that works and if you could expand a little bit on what that experience has been like for you during the pandemic.
Sure, maybe, or do you want me to start? Okay. So yeah, I think, in the FEST as it was called earlier, talked about the $926.7 million. I think about 90 million of that went specifically to urban. It's what becomes a challenge is that we don't want to be looking at, on reserve in the North communities as a comparator group for urban Indigenous people. I think that, there's enough need and there is enough capacity within the urban settings that we should be thinking about it as a group on its own. Because we don't want to get into this, does it go here or does it go there? Every resource that's going to First Nations, Métis, Inuit governments for the work that they're doing in the communities is absolutely needed, and that's probably not enough to build the capacity. And we're trying to close gaps from like a historical lack of investment in our capacity and infrastructure. But standing on our own and trying to convince levels of government in different departments about the need for culturally specific urban Indigenous supports and responses to COVID has been a challenge. We work well with Indigenous Services, the group that we have our federal program with, but I had conversations early on with other departments where I was kind of starting from scratch about why is it necessary to fund a network like Friendship Centers or other urban Indigenous organizations. Our respective provincial territorial associations were in constant contact with the provincial governments and relaying that information to us as well, and as well us relaying information to them. And it was quite frustrating early because each level of government was looking to the other to say, well, this is your jurisdiction, no, this is your jurisdiction. And meanwhile, we have, like I said, Friendship Center staff like cooking meals out of their own homes to deliver to people. And so I don't mind taking up those fights at the national level or trying to get people to talk to each other. Where I think it's unfair is the local Friendship Centers in just being out there providing those supports. I don't think it's fair that they're the ones that have to fight and really convince people of the needs, because they're doing it and they're going to do it out of their pockets, or they're going to do it to the financial health of their own organizations, and so we're just trying to make sure people know the realities, that people who are making decisions about funding and policy and program designs are aware that this is a very real thing that's happening, and specific responses are needed outside of just the current structure that we have.
Sorry to interrupt. That's to our time. Members of the committee, I'm advised by the clerk that we're able to extend past 1 o'clock because technically we're not holding up a subsequent meeting. So I'm going to propose that we have one more round of questioning from each of the parties, which will take about 15 minutes. And this once again will go on the unanimous consent. If anyone's opposed to that, because we have to get agreement to go past 1 o'clock. So not seeing any opposition to continuing for 15 more minutes, I'll ask a 5-minute round of question to go now to Ms. McLeod and Mr. Vidal. Kathy, please go ahead for 5 minutes.
I think Mr. Vidal was going to go first, and then I'll follow up.
Whatever. Go ahead. Thank you.
Thank you, Mr. Chair. And if you want at the 2.5-minute mark, just please transition for us there. I'm going to have just one quick question for Mr. Shepard and Ms. Formsma. Sorry, I did it too. And it's around the community support funding. I know like the original round of community support funding included $15 million for urban Indigenous, and I know that was some concern at the time about the recognition of the need. Another $75 million was added to that sometime after that. But my question goes beyond that. When we get to the next round of the community support fund, out of about $300 million, there was about $160 million of that was on an application-based process that actually just closed yesterday, if I'm not mistaken. We're well into the second wave, and the application process literally closed yesterday. And now there's another announcement yesterday of some more money under the community support fund. Don't know how that will roll out. I'm just looking for your comments in regards to the application process, and if that was burdensome or helpful, or kind of just how you felt about that process.
I think early on that because the Friendship Center, the National Association of Friendship Centers has an existing agreement with Indigenous Services through the Urban Programming for Indigenous Peoples, as well as the Urban Indigenous Coalition tables. It was our position that we felt like there was already an existing mechanism to at least release dollars immediately. It wasn't going to be a perfect process, and certainly there was time to open it up to other organizations, but we felt that that would have been at least an immediate release of funds that could have gone to the Friendship Center network and the Urban Indigenous Coalition Table network as an interim component. That wasn't utilized in the beginning, and so it resulted in us having to wait weeks after other Indigenous organizations received funds. It didn't mean that the work stopped or halted. We went ahead and did it anyways without a guarantee of there would be funding there. I'm going to hand it over to Chris just to fill in from his perspective, but that was my experience.
I think we were in front of committee right around when that was happening in the first run, and so being someone who works in a region and works with individual centers every day, I was extremely frustrated that while people were getting direct investment without delay, we were having to contact centers whose staff were working in the now and ask them to start collecting data and information so we can get an application into Canada so that we can get the support to help people. I felt frustrated in round 2 when the same thing happened again, because you're delivering funding to Indigenous organizations, but you're treating urban ones differently by forcing them to apply. We're now in round 3 and it's the same process again. And I think even if Canada had looked at our pre-budget submission and looked at what we had submitted as need, in that submission was the request for money to create an urban Indigenous health framework.
Ms. McLeod.
We've submitted those things previously.
Thank you. And I'm going to go back to Dr. Wyman. And from the last panel, we heard concerns that were raised in terms of the rapid testing. And I'm going to give you a quick example. Without rapid testing, healthcare workers are going into communities. They're essentially having to, under many, many rules, having to completely isolate, regardless of the results. And so I guess I'm sort of getting back to that balance for our healthcare professionals and applying rapid testing and applying policies that might make life a little bit more normalized for these caregivers. And so if you could just talk about that piece, both rapid testing and policies related to rapid testing and healthcare providers.
Great, thank you very much for that question. I think as the other witnesses have mentioned in the previous hour, and I think in this hour as well, rapid testing, for example, is definitely necessary in many different situations, such as you mentioned. Part of the challenge is, especially again for rural and remote communities, that it's not feasible to put capacity to do rapid testing in every single community, but the hubs that were mentioned by Mr. Smith, I think the previous hour, is a workable idea. And here in BC, for example, we are in the process of putting some of those gene expert machines in at least one per region, but it has been really a slow going kind of process. And so it's unfortunate that, I can't believe actually that, we're hearing delays in getting results back of 4 or 5 days. It is quite surprising to me to hear that someone goes 10 days without getting their result back, because that means they're essentially at the end of their self-isolation period by the time they get the actual positive COVID test result. But so I think, that is a very big issue. But the other thing to remember too is, two things really quickly. One is, even there's some, rapid testing isn't necessarily the gold standard for testing for COVID. So there's a possibility of getting inaccurate results. But also it's critically important for people who are coming from urban centers to provide services, especially to rural and remote services, that they do whatever they can to prevent the transmission of COVID-19, given the vulnerability of our population. And I don't often use that word vulnerable, but in the COVID sense, yes, we are. And then lastly, I think, it's important to remember that COVID testing in and of itself is really a snapshot of a period in time, and that it doesn't necessarily guarantee that you won't be exposed or, pick up the virus and become contagious yourself somewhere quite soon after the actual test in and of itself. So there's lots of challenges, but we are, advocating for doing as much as we can to keep our communities and especially our elders safe.
Thanks very much, Dr. Wyman. Jaime Batiste, please go ahead. You have 5 minutes.
Thank you, Mr. Chair. And, I'm coming to you guys today from Eskasoni, Mi'kmaq community. It's the First Nations reserve of about close to 5,000 people. And with my discussions with Indigenous caucus, we've been noticing across Canada, it's been a really tough year for Indigenous people in 2020 because regular areas of prevention methods around supports, around ceremony, social gatherings such as powwows, athletic events that were held between communities in terms of hockey tournaments, all of these things have been canceled. And it's really done a number on our communities in terms of their mental health, but also we're witnessing a lot more addictions in terms of alcohol as well as opioids. And we're looking at this winter coming in as a very bleak one for First Nations across Canada, on reserve and off. And we're really looking to get some recommendations out there. I know that the most recent funding announced said that we were going to do 631 million over the next 2 years for a public health response, as well as an additional 82.5 million for mental wellness needs. I'm wondering if the witnesses can give us some recommendations on best practices around ensuring Indigenous youth, Indigenous people on reserve, that we can still build up their morale and their hope during a pandemic that has taken so much from them. And so I'm just wondering if you can give us any kind of best practices, recommendations on that funding and what is working in terms of ensuring that we're offering the supports in the right areas to Indigenous communities. Thank you.
Who'd like that?
So I guess I'll quickly go. Thank you, Mr. Batiste. I think number one, especially we're talking about Indigenous young people, let's recognize that Canada doesn't have any specific one-stop program that supports the development of Indigenous young people at all. So for the fastest rising demographic in Canada, the people who will be our economy in 20 years, there's nothing. If there is anything that exists, it's a subcategory of a current program. So you could serve vulnerable women or vulnerable young people. Canada once did have a program specifically for young Indigenous people to come up and become leaders and, to be involved. Myself and Jocelyn are actually two people who went through that same program at the same time. And so to me, it's why do we not have something? And this is something that myself and Jocelyn have presented at multiple levels of the federal government for a very long time. That, if there is anything specifically, it's a specific program for children, a specific program for young adults, regardless of where you live, that looks at how do you support them in becoming able to access the same success that other children in this country do. To me, that's something that is critically important. And I try to remind everyone this, that young Indigenous Canadians are the Canadian economy in 20 years. So if you want a successful Canadian economy, you have to support those people who will make up the people who are forcing that economy forward. And it's not going, you won't have a choice.
And what was that program called?
It has gone by many names. Originally, Urban Multipurpose Aboriginal Youth Centers program. It was a part of a program under Canadian Heritage, then CCAY, and then into non-existence.
So in terms of this 82.5 million for mental wellness needs that we've announced, you believe a distinct category should be created for youth to support youth during this difficult time? Is that what I'm hearing?
I think in general, like we have said that COVID is just one more piece of a puzzle that has been what we've dealt with for the last 70 years. It's just another challenge for us. We've had young people within our movement across the country create mental health programs for submission to Canada that weren't funded. And so one thing we've been very, very lucky of as a national organization was to be approached by private funders that's who's getting us the support to get a youth mental health and suicide program off the ground is actually a private corporation, not Canada. So we really welcome Canada to come join us and create some amazing things for young people. But the reality for us is that we had to figure out a way to do it.
Thanks very much. Thanks, Mr. Baptiste. Madame Bérubé, 2 minutes et demie, s'il vous plaît.
Merci, Monsieur le Président.
Thank you, Mr. Chairman. You mentioned, Mr. Shepherd, that the friendship centers aren't within the measures for the support, and Canada must start considering them as partners within the context of the pandemic. How has Canada, how can they use the friendship centers so that they can help Aboriginals living in the city?
That Canada and Friendship Centers have a 70-year history, a once permanent program history that has been developed to, like, it's a self-determined structure created by our own people to move ourselves forward. We have been a welcoming place to collaborate, to do work, to make sure our people are looked after, not just in the pandemic, but at all times. But on the back end, and even in public policy, urban Indigenous people aren't included. StatsCan data tells us every year that, you know, it's not like urban migration is slowing down or stopping. It continues to happen. But we, as a country, seem to not be able to say the truth, which is you are all important and we need public policy that says that. And so why is it that if you did an analysis and a scan of how urban people are funded comparably, there's nowhere near equitable? You know, we did an analysis of the COVID response money. Canada says that they want to make sure there's a gendered lens on the work that they do, and there is not. And I can tell you that COVID is no different. So when we look at how do you do work post-COVID, in some regions, we're already looking at a gendered response lens to how do we make sure that Indigenous women, who typically are the backbones of communities, are supported to recover their communities collectively.
Est-ce que les mécanismes ont...
Questions. Are the mechanisms in place so that there can be links between you and the government?
Well, I think we have such a long history of working together, but oftentimes we aren't there in the onboarding, the development, the creation, the design, which can be extremely problematic when you're trying to measure impact or even have impact. And so I think the reason in my statements is that if you read almost every statement I've made to a committee, it always says, we welcome the opportunity to work with you and to bring our experience, because I still genuinely feel that there are so many opportunities that go missed with urban organizations and not even just our own, you know, but we're on the ground making those connections with other Indigenous organizations or others, literally anyone who will work with us, just to make it more efficient.
Thank you so much, Mr. Shepherd. Ms. Blaney, you're the final questioner for this round. Please go ahead for 2.5 minutes.
Thank you, Mr. Shepherd and Ms. Vormsma. I'm going to come back to you again. I just think about when COVID first came out, and a lot of nations on reserve were calling me in heartbreak because they had people that were living off reserve calling their office and they didn't know what to do. And so they were calling saying, where do I send my folks? Because of course they don't have the resources to send, in some cases, quite a distance away to support people. So I just want to recognize that. And when I hear you talking about this sort of jurisdiction debate about who do you belong to anyway, and we know that when that discussion happens, people are falling through the cracks. If you could just talk about how the impact, but also the impact on frontline workers and leaders within your organizations across the board, and the burnout they must be experiencing, not only because of the pandemic, but because they are always in this place of writing another proposal and uncertainty.
So in Saskatchewan, I can speak to specific examples because they did surveys with their members at the beginning of the pandemic, in the middle of the pandemic, and are ongoing throughout, just to accurately tell the story of what it's been like. And I remember one of the most heartbreaking comments I read in one of the narrative portions was an executive director with 47 years experience of running a center in northern Saskatchewan, whose only comment was, "I wish I retired in January." And for someone if you imagine the last 47 years of Canadian history and what that woman has worked through and for, that this was the thing, that this was the moment that broke that woman, was trying to survive COVID and provide support to her community. The jurisdiction, and the thing that I think, if I can be very personal to me, is it's extremely difficult to sit in front of committee and bring testimony when you know for a fact that we have Jordan's principle. Why is there any jurisdictional wrangling around whose responsibility people are when we have legal precedents on, putting aside jurisdictional issues and making sure the right things just happen? It's not like we don't have templates for what we need to do. It's just that in this moment, everyone is uncomfortable saying the truth. Well, at the ground level, I have executive directors who are self-isolating themselves because they've been serving food with inappropriate PPE because no one else would. All of our centers, most of our centers are still open while other people are working from home. And so the reality that I live every day as the president of that is trying to tell that story, that when you get testimony from people and you get recommendations from people, we need to see at some point that comes with an action.
Thank you.
Thanks, Ms. Blaney, and thank you to all of our witnesses. This has been a remarkable, profound testimony that I know will show up so prominently in the work that our analysts will do in preparing a report, and then as committee members dealing with the draft of that report for recommendations to go forward. But I really appreciate all of you. It was an exceptional day in both of our panels today, and thank you so much. And that brings to an end this meeting of the Indigenous and Northern Affairs Committee. This meeting is now adjourned.